Welcome back, everyone. It's likely you've heard of Botox and fillers, right? It's the miracle tools that really help women look younger. But how do they really work? Dr. Thomas Kotoske is here, and also one of his patients, Kristen, and they're going to tell us more about it. Thanks for coming on the show today.
You bet. Nice to be here.
I think, this is great. You're kind of demystifying something a lot of us have heard about, but maybe we haven't done before. You call it actually non-surgical facial rejuvenation. Tell me more about that.
Non-surgical facial rejuvenation involves the use of Botox and facial fillers to basically erase wrinkles, take care of folds, replace volume, and just restore youth.
Okay, now with Botox, how does that work? I mean, it's pretty simple, it seems like, these days.
You know, Botox is not really as cookbook as it's made out to be. It is simple in the hands of someone that knows how to utilize it. But
Good
what
point.
It does is it's a product or an agent that basically stops muscle contraction, smooths out wrinkles around the forehead, eyes, what have you.
Okay, and we'll show some before and afters coming up with right here, actually. And you can see the lines being removed. Is that what you're going for with Botox, more of the forehead or other areas?
With Botox, we do two things. We try to shape the brow. We try to enhance the way that the eyelid region appears, but we're out to remove wrinkles as well. And so it's kind of a combination therapy.
Okay, now what about facial fillers? I know, Kristen, you recently had this procedure done, and we can show photos of that as well, and you can tell me exactly kind of how that worked.
Kristen came to me to have some lip enhancement to take care of her nasal.
Fillers. I know, Kristen, you recently had this procedure done, and we can show photos of that as well, and you can tell me exactly kind of how that worked.
Kristen came to me to have some lip enhancement to take care of her nasolabial folds, these folds on her face. And, she's a beautiful woman, and what we wanted to do was enhance her lips, take care of the Cupid's bow, or develop that line on her lip in conjunction with softening the lines coming down from her nose. And it basically took us less than 20 minutes to do it, and virtually painless to do it as well.
Yeah, you can see, of course, the photos here. And tell me about your experience with it, Kristen.
It was very minimal pain. I wouldn't even call it pain. It was mildly discomfort. It lasted about 20 minutes, the whole procedure, and it's been a week now. It's been 1 week, and I'm perfectly happy. I feel really good about the results.
Yeah, that's the thing. I mean, did you get what you were after? I mean, because it doesn't look like you've had anything major, but I know how it feels. Yeah. I know how it feels. And it's got to feel better when that's just a little...
Yeah, it does. It does. It feels much better. Yeah, it's a real soft look, and it was done, like I said, very simple, easy, right in the office.
Yeah, very easy. It sounds like, of course, getting the procedure done. Now, who is a candidate for these type of procedures?
We have patients that span from their 20s all the way up until their 80s. And it's anybody that's a candidate for wrinkle removal, volume replacement, as really someone that could utilize these types of products.
Yeah, we're seeing, of course, another one of your patients here we're showing who got the Botox, and then did she get fillers here?
Right, and this patient, we filled the nasolabial folds. That's the fold that comes down from the nose down towards the lip region. We also did some lip enhancement, but very soft. We just wanted to soften her whole facial profile.
Yeah, you were talking about lip enhancements, and I know you actually did a salesperson here from Channel 12, and we can show her photo, because I know she's really thrilled about the way it looks. Who is a, candidate for that, and who would you suggest for that?
Well, first of all, we couldn't never tell you who that actually is, but the reality of it is, she needed some plumping, some more definition of what's called the Cupid's bow. That's the upper aspect of her lip, and gain some balance with her lips. That was our main thing we wanted to achieve, plus soften the folds coming down from the nose. But a candidate for this would be anybody that spans that age group, 20 to 80s, that has folds, volume deficit, wrinkles forming. We have an opportunity to correct that.
And how do we make sure that we're going to get like a beautiful look like Kristen? How do you make sure that happens? Because I think that's why a lot of people are like, oh, I'm nervous about messing with my face, but when it looks like that, you're like, great.
It requires discussion, analysis, and you need to go to someone that's an expert in that area. There's a lot of med spas that open up where people have had a weekend course for training. You need to know the anatomy. You need to go to a surgeon that does this, that understands that whole piece.
And that's
what I
important.
recommend.
I think that's
Sure.
a major point there. And you also have, though, a special Valentine's Day deal. Tell me about that.
We do. It's called the Kiss Yourself Beautiful program, and what it is we've tried to help those patients that support the Cosmetic Surgery Institute by creating a package. And it is a package that has Juvederm, Botox, and a complimentary Latisse for enhancing your eyelashes as well.
That
So
works, too.
it's a great facial rejuvenation package for people.
All right. I love it. There you go. For more information on that or anything we talked about today, just go to bodybykotoske.com or call the number on your screen. Thanks a lot, you guys. We appreciate it.
Our pleasure.
All right, coming up next, everyone, big changes in what the government recommends we eat, how to incorporate the new guidelines at the grocery store. Plus,